Good evening to the listeners of India 50 Plus Radio. This is Colonel Pradeep Pindyala, Professor of Anesthesiology from Asram Medical College, Eluru, city of Andhra Pradesh, India. Friends, as I have promised you earlier, I'll be introducing you briefly about certain medical conditions which will be very useful to you for basic understanding how it works. Today I would be introducing you to the subject of hypertension, blood pressure. It's also known as high blood pressure, BP. In a long-term medical condition in which the blood pressure in the arteries is persistently elevated. High blood pressure typically does not cause symptoms. Long-term high blood pressure, however, is a major risk factor for stroke, coronary artery disease, heart failure, atrial fibrillation, peripheral arterial disease, vision loss, chronic kidney disease, and dementia. Name anything and everything. All the problems can occur because of high blood pressure. Now, how they can be classified? High blood pressure is classified primarily into two: primary or essential hypertension or secondary hypertension. About 90 to 95% of cases are primary, defined as high blood pressure due to non-specific lifestyle and genetic factors. Now, lifestyle factors that increase the risk of hypertension include excess salt intake in your diet, excess body weight, smoking, and alcohol use. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as high blood pressure due to identifiable cause such as chronic kidney disease, narrowing of kidney arteries, and endocrine disorder, or the use of birth control pills, contraceptive pills. Now, blood pressure is classified by two measurements: the systolic and diastolic pressures. I'm sure you know this much, which are the maximum and minimum pressures respectively. For most adults, normal blood pressure at rest is within the range of 100 to 130 millimeters of mercury systolic and 60 to 80 millimeter mercury diastolic pressure. For most adults, high blood pressure is present if the resting blood pressure is persistently at or above 30/80 or 140/90 millimeter mercury. Different numbers apply to children also. Ambulatory blood pressure monitoring over a 24-hour period appears more accurate than office-based blood pressure measurement. Now, coming to lifestyle changes and medication which can lower blood pressure and decrease the risk of health complications. Lifestyle changes include weight loss, physical exercise, decreased salt intake, reducing your alcohol intake, and healthy diet. Now, very interestingly, if lifestyle changes are not sufficient, then blood pressure medications have to be used. Up to 3 medications taken concurrently can control blood pressure in 90% of people. The treatment of moderately high arterial blood pressure, defined as more than 160 oblique or slash 100 millimeter mercury, with medications is associated with improved life expectancy. Your life expectancy can reduce drastically if you are continuing to have high blood pressure for long. The effect of treatment of blood pressure between 130 by 80 millimeter mercury and 160 by 100 millimeter mercury is not very clear. And high blood pressure affects between 16 to 37% of population all over the world. Incredible but true. 16 to 37% of global population are right now suffering from high blood pressure. Thank you for patient listening. More in my next brief introduction. Bye bye. Take care. This is Colonel Pradeep signing off. Bye bye.